once we have resistance to immunotherapy, several, or immune checkpoints, let's say it this way, several features play into here. So we have things related with the host, with the tumor, and I gave an educational session on that, covering several things. I guess this is a very tricky question because, in my opinion, we have data already. There are the responsive patients, right? Those patients, independent of other features, they respond. We have the resistant patients that even if we modulate probably the gut microbiome or the chronotherapy that's now been discussed, even if we do that, they are still resistant, right? So I guess what we have to now start to divide patients into are the responsive patients, the resistant patients, and the ones in the middle that they might be responsive if we modulate those things, right? But I think your question goes beyond that. How can we tackle those resistant patients? Well, this is, if we needed the answer, we wouldn't be here, right? But from my perspective, we have novel strategies in terms of immunotherapy. Of course, we have to use, again, biomarkers to select those patients. They tend to be a bit more probably tricky techniques and drugs to treat with, might be more toxic, some of them, not necessarily. So I'll probably highlight the personalized vaccines, but not only personalized. So I'm going to talk about the immunomodulatory as an oral presentation here about immunomodulatory vaccine. That's a very interesting concept, and those are not toxic at all. So that's one of the ways to probably overcome resistance, even though that trial was not in that setting. We have TILs and all the cellular therapies, okay? So TCR T cells, CAR T cells. Of course, all of them, they have their limitations. Some of them, they only target one antigen, some target multiple antigens. But I think what we have to do is to identify the resistant patients and be smart and try to treat those specific patients with these novel technologies and try to get better.